Good afternoon, everybody. I'm happy here to present my work, my research work, relationship between parenting attitudes and stress coping strategies of military inpatients with adjustment disorders in Taiwan. There are limited studies on the prevalence of adjustment disorders across different countries. The reason for that may be because adjustment disorder is not a severe psychiatric disorder, as well as the diagnosis suffers from the validity issue. However, the prevalence of adjustment disorder in general population was estimated to be 1.4%, and in primary and consultation liaison psychiatry settings are ranged from 7 to 34%. Adjustment disorders has been conceptualized as a stress response syndrome and occurred in a stress-related situation. The military service in Taiwan is compulsory, although we are moving toward to a conscription. Currently, it's still mainly a compulsive system. Draftees in service are in their early adulthood and face a transition period from liberal individual-oriented environment to a strict group-oriented environment. They have to cope the stressful environment and learn to change their behavior and the value system to cope with the intense stress. If they are failure to do so, very often they would suffer from the symptoms of adjustment disorders. According to a recent report of the Ministry of National Defense of Taiwan, about 22% draftees who have received counseling showed maladaptation, and they are in a high-risk group of suicidal behavior and sickness of leave. Theoretically, family function and parenting attitudes would influence the development of one's personality, emotion, and stress coping behavior. But a few studies has targeted on the influence of family function and parenting attitudes on the military personnel with adjustment disorders. We think this population could provide a good opportunity to investigate the theoretical relationship. So the specific aim of our study is to investigate the association between parenting attitude and stress coping strategies of military patients with adjustment disorders in Taiwan. Methods. The study was conducted in 4 hospitals of the northern part of Taiwan from April 1st, 2013 to March 31st, 2015. 2 years period. The inclusion criteria are military patients who admitted to psychiatric wards and met the DSM-4 TR diagnosis of adjustment disorders. And the exclusion criteria is patients with repeated hospitalization because of the maladaptation. They will come back repeatedly admitted to hospital, and illiteracy. In the end, 264 patients met the inclusion criteria, and the participant rate is 96.6%. And 250 patients complete the consent forms and enroll the study. Patient participants were interviewed and complete the questionnaire within 3 days after their admission. The measurement we used, including the parental bonding instruments, PBI in Chinese version, to measure the parenting attitudes. This instrument is a self-reported 4-point Likert scale. There are 25 items, each item scored from 0, very unlike, to 3, very like. There are 2 subscales termed care and overprotection in the scale, measure fundamentally parental styles as perceived by the participants during their first 16 years. And another one is COPE inventory in Chinese version, and to measure the variables of stress coping strategies. It is also a self-reported 4-point Likert scale, 60 items, each item scored from 1, which is usually don't do this at all, to 4, usually do this a lot, and ask the participants to indicate what they generally do and feel when they experience stressful events. And the COPE inventory includes 15 subscales, including positive reinterpretation and growth, and mental disengagement, focus on and venting on emotions, use of instrumental social support, active coping, denial, religious coping, humor and behavioral disengagement, restraint, use of emotional social support, substance use, acceptance, and suppression of competing activities, and planning. The data analysis, we use a multiple linear regression. By treating scores of COPE subscales as dependent variables and the scores of PPI subscales as independent variables, a series of multiple linear regression were applied for data analysis. The study results. After controlling for the variables of education levels and hospital locations in the regression, the COPE strategy of denial was significantly positively associated with the domain of overprotection with a p-value 0.004. And the coping strategies of behavior disengagement was also significantly positively associated with the domain of overprotection with p-value 0.001, and negatively associated with the domain of care with p-value 0.028. The rest of stress coping strategies had no significant association with the variables of parenting attitudes in the analysis. Analysis results. So the study limitation, because we only use the northern part of data from the 4 hospitals, so more data are needed from other parts of Taiwan in the future. Advanced studies are needed because adjustment disorders have 4 subtypes, so we need more data to analyze in different subtypes of adjustment disorder. And the implication of the studies, and this study result provide useful information about the risk factor of adjustment disorder for the military population, who are mainly young adults and typically vulnerable to stress environments. And also it facilitates evidence-based mental health intervention in the future. Thank you for your attention. Yes.
Okay, so the men, both of these were significant in both of these were significant in populations of the men, the male,
male population,
and denial as well as disengagement.
Yes.
And so both were highly significant, which is interesting because the denial factor, walling it off, but then there was a disengagement, and the disengagement was to what? Disengaging from
the stress situation. And
The family?
No, this, because it's such measure the stress coping strategies. So the question usually asks some situation when they face the stressful feeling or experience, what they will do.
The way they coped
Yes.
was to deny it and to disengage.
Yes.
Which is, I think that's very fascinating, and I think that could be teased out a lot to kind of think about that coping style for men. So.
Yeah, because in Taiwan, most Japanese are male, so majority the data from male. May be different from female, but we need more data to analyze that.
But to me, I think it's very significant that it just pulled out two specific things, and those have meaning, I think.
Okay, thank you. Thank you.